Indigenous Australians living in rural locations between the ages of 16 and 24 have a high risk of developing mental health issues. In 2008, an estimated 31% of Indigenous teenagers had high or very high levels of psychological distress, with common issues being anxiety, post-traumatic stress disorder, and depression. Indigenous view mental health as holistic, involving spiritual, social, emotional, cultural, physical and mental well-being and issues relating to the land and way of life. Due to these cultural barriers, Indigenous people feel that Western models of treatment focus more on medication, counselling and hospitalisation and do not take into account their holistic view or cultural beliefs. They believe strongly in spirituality being linked to individual well-being, with the onset of mental illness, ill health and negative life circumstances being attributed to external forces, and could be perceived as payback for previous transgressions. Furthermore, there is evidence to illustrate that family, the environment which they live, and their history are some of the main factors that trigger Indigenous youth to have poor mental health. Historical events such as the Stolen Generation have promoted a transgenerational effect, influencing individuals to still fear and lack trust in the government. Good family functioning and community care for the youth are essential to their development. The youth population of Indigenous Australians living in rural areas show higher rates of serious mental health problems than those living in metropolitan areas, due to disadvantages and risk factors that they face. Social determinants such as low levels of income, employment and education contribute to the poor mental health in rural areas. Due to little knowledge of mental health literacy, lack of trust in mainstream services, affordability and cultural beliefs, families may avoid mental health services for young people as they may feel shame or fear. Also, the lack of education can limit future opportunities for individuals, and with low levels of employment create stresses about not being able to find employment to create a future for themselves. Indigenous Australians' home and social life seem to have a significant influence on mental health. There are several reports of experiences of sexual, emotional, and physical abuse, being neglected within their homes, feel disconnected from their own culture, and being ostracised from society through racism. Each of these factors negatively impact individuals' self-esteem, as there seems to be no place in which they can feel safe and accepted. Despite the prevalence of mental health disorders among Indigenous youth in rural areas, the issue is often not recognised, with inadequate mental health services available. Clinicians working with Indigenous youth experience difficulties due to the lack of cultural understanding. This can result in negative experiences for the Indigenous patients because of the failure to communicate and be culturally appropriate, and to acknowledge traditional methods of treating mental health problems. Indigenous Australians from rural areas are unlikely to seek healthcare due to various social and environmental lifestyle factors. Barriers to accessing mental health care services include a lack of transport and services, long waiting hours, problems with health insurance, difficulties understanding language used by service providers, and cultural barriers. Approximately 80% of Indigenous Australians living in rural communities don't have access to mental health services, and 65% don't have access to a general practitioner. In comparison, Indigenous Australians living in metropolitan areas are 3 times more likely to receive help for specific and non-specific health needs. Mental health treatment and programs should be adjusted to meet the needs of Indigenous communities. By shifting the focus from service provision to cultural appropriateness, mental health facilities will generate a deeper understanding of practices and policies best suited to the population. By exploring historical, cultural, social and economic factors relevant to mental health of Indigenous people, it will improve the success and participation of treatment. The first mental health facility that focuses on enabling Indigenous Australians to access mental health treatment has opened in Adelaide, South Australia. It has been designed exclusively for clients from remote areas and has a unique focus on the treatment of Indigenous patients. There is a special emphasis on culturally appropriate spaces such as the outdoor garden, and it also has Indigenous healers and private rooms for patients and their families. The facility aims to integrate Western medicine with traditional healing to generate the best results for its patients. This is a step forward in the right direction for mental health of Indigenous youth, because it takes into consideration factors such as cultural background, risk factors, and barriers to accessing mental health services.